Dr. Brian Heaberlin here with Lexington ENT and Allergy, and I want to discuss adenoids. So a lot of people don't even know what adenoids even are. The adenoids are lymphoid tissue that is in the back of the nose. We typically see this in young children, and most adenoid tissue will start to involute or go away by the time someone's a later teenager or an adult, although some adults certainly can have enlarged adenoids as well. The adenoids are often enlarged at the same time as someone's tonsils are enlarged, but we will usually see the adenoids be a problem at a little bit younger age than when kids have tonsil issues. So often kids between 12 months and 24 months of age may have a chronic runny nose or nasal stuffiness and congestion. And oftentimes the adenoids are so large that it's blocking the back of the nasal passage. So all of the nasal drainage that's created can't flow down the back as it should, and we see kids have a runny nose or stuffy nose all the time. So removing the adenoids can certainly improve nasal drainage in those young kids particularly. We will sometimes see kids get chronic sinus infections, and removing the adenoids will actually improve many kids' sinus infections without ever touching the sinuses. We will often remove the adenoids in relation to kids with multiple ear infections. So the adenoids sit near the eustachian tube opening in the back of the nose, and so the adenoids can be so large that it covers the eustachian tube opening, or at least can cause inflammation and blockage of the eustachian tubes, which is what leads to kids having fluid in their ears and infections. The adenoids can be just a reservoir for bacteria that can infect the ears as well. So adenoids, most people obviously don't need to have anything done with their adenoids, but a lot of young kids that are having these problems that I've mentioned, removing the adenoids is very helpful. Removing the adenoids is a smaller procedure. When it's done without tonsillectomy, is a much smaller procedure than, say, a tonsillectomy. So kids typically have a very quick recovery, do very well, often don't require any significant pain medications, and just quick return to normal functions. So if you have a young child that has a chronic stuffy nose or chronic runny nose, certainly could be some allergies leading to some of those things, but often the adenoids are overlooked, and removal of the adenoids may correct that problem substantially. If you have questions or concerns about that, we're happy to look at it here at Lexington ENT and Allergy and see what we can do to help. Thanks.